innovation and patient-centered care are reshaping the approach to complex diseases like chronic myeloid leukemia. And today, living with CML doesn't just mean surviving, it also means thriving. Joining us live this morning for more on the advancements of CML treatments in Canada are Lisa Machado, founder of the Canadian CML Network, and Dr. Dennis Kim from the Princess Margaret Cancer Centre. Appreciate both of you being here this morning. Nice to meet you both. Lisa, let's start with you, your story dealing with CML. You sort of started this organization. What is your personal story connected to all of this?
So 2008, I have little kids and feeling completely fine, have a weird bruise on my arm, get it checked, and 12 hours later I find out I have leukemia. And came completely out of the blue. Mm-hmm. And I learned two things really quick. The healthcare system is not kind to people who are sick. And also as a patient, ironically, when you're most vulnerable is the time that you have to advocate most for yourself.
Absolutely. So 17 years, I'm sure you've seen a lot of changes in treatments. And I know you've been dealing with Dr. Kim as well here. Can you talk a little bit about that for yourself? Because clearly your own advocacy has helped you.
Yes, it's been a wild ride, actually. When I was first diagnosed, there was one drug. Pretty sure I was going to die. I didn't think I'd be sitting here, that's for sure, with Dennis, which is pretty cool. But now, yeah, with the investments now, we have so many choices. There's lots of options. We can make decisions based on quality of life now, which is a gift.
Well, that's remarkable. And Dr. Kim, that must be amazing. I'm sure very, satisfying for you to be sitting next to someone who didn't think they'd be able to be sitting here when they were initially diagnosed. What can you tell us a little bit about the innovations and treatments when it comes to people living with CML?
Yes, so in CML, I think that 20 years ago, we have only one drug available, but now we have 6 drugs available, and we are not just looking for the survival, the prolong their survival after the diagnosis of CML. We are now looking for the improving their quality of life, as well as their functional ability to proceed their professional activity while they are getting treatment for their CML.
Yeah. Something stuck out to me, in the notes that I was given here earlier, talking about. I'm sorry, I've lost it, but about sort of limiting like the challenges, the tolerability challenges. Those are the words. I should have highlighted it. What does that mean specifically, tolerability challenges? Is that to the one drug or to one of the 6 drugs now?
So I think that most of the CML drug, because they are now blocking some molecular target called the ABL1 kinase domain, particularly the ATP binding pocket, which after binding their pocket, then it is not just killing the CML cells, it also make lots of effect on a non-CML CML tissue. Yeah. So they are going to end up to have a lot of side effects.
Yes.
Because of that, but in some degree, it is tolerable, it is acceptable. However, they are not functioning as they have to be. So that's why I think that we are looking for the other kinds of molecular target. Another target is called the myeloid pocket, and that by blocking that one, then we can try to reduce that kind of toxicity coming from that kind of side effect.
Right. So Lisa, what's this been like to you? Have you been on all of these drugs? Like, what did it come to sort of find out what was working for you personally?
I've actually only been on one, which is not very common, really. So I've been on the same medication, but I've worked with a lot of patients who've had to move and change based on side effects. And I think that one of the things, like to what Dennis said, is that we make a mistake when we compare or equal survival with quality of life, right?
Yeah.
And it sounds nuts, to say to someone, oh, well, I'd rather not live, for example, if I can't walk my kids to school, if I can't do what brings me joy in my life. Yeah. But that's a fair decision to make. And so we're getting to a point now where we're having conversations with our doctors more about what brings us joy, right? Yeah. And so if we have this gift of a medication that keeps us alive, which we're so grateful for, but we want to be up and around and enjoying life and like getting happiness out of life. And if we're not doing that, then we need to be working with our doctors to try to get that.
Like quality of life versus sort of spending your dying days or remaining days in a hospital bed. Right, is that kind of what you're getting at here?
Terrible.
Right, yes.
Feeling terrible, right? And so we have patients in our network, in the Canadian CML network, that actually make conscious decisions not to take medication because it makes them feel badly, right? Yeah. And so if you're not enjoying your life, then I kind of have to say, what's the point?
Okay.
Right, Dennis?
I think another innovation in the CML area is that I think in 2015-16, we tried a Canadian TKI, the CMA drug discontinuation clinical trial, and it was very successful. Roughly around more than 60% of our CMA patients, they can stop their treatment without losing their leukemia control.
Right. Well, listen, Dr. Kim, thank you for the work you're doing. I appreciate this. Nice to meet you this morning.
Thank you.
Lisa, thanks for your advocacy. Great to meet you as well. Appreciate this. That is Wellness Wednesday for this Wednesday here on CB24 Breakfast. We have coming up right after this.